The Bend Police and Fire Departments have partnered to train and equip police officers with automated external defibrillators, or AEDs. Police officers are also training in advanced CPR techniques. Take a look at what this means to emergency response in Bend.
It became apparent that we were not going to be able to really change our resuscitation outcomes in Bend without the help, without partnering with Bend PD, dispatch, and the public. So for that reason, we reached out to Bend Police and asked if they wanted to participate and be part of this. And they overwhelmingly jumped in, and they've been very good, very receptive partners, far exceeding what we had ever hoped.
The police department did not have any AEDs in our patrol vehicles. We worked really closely with the fire department, understanding that there's a need for our response. We're usually on scene first. The fire department has also gone to high performance CPR. So in conjunction with the AEDs and the CPR, working with the 911 dispatch, we've been able to get a process together where we're working to increase survivability rates of witness cardiac arrests.
So when we looked at our stats, we've quickly found that the police department on average was beating us in 2 to 3 minutes on scene faster than us, like 80% of the time. And we know one of the most critical factors in cardiac arrest is time, the time to start moving blood. And so early CPR is what's key, and we couldn't do it without the police department being there before us, and it will help save more lives having them there earlier.
So the police department felt this was important enough to train our entire department, or entire patrol staff, on high performance CPR. We incorporated it into our quarterly training to get everybody in the department trained on how to use the AED in conjunction with high performance CPR. That is what is bringing this together with the fire department. We brought the fire department in to give us their training on how they want us to do the CPR.
When the first officer arrives on scene, he will go upstairs with the AED and the bag valve mask, but his primary job is to do CPR first. We know that the heart is not receptive to shock without good CPR prior to that. The second officer, part of his team, will then place the AED on and charge it and shock the patient if it's needed.
It's really important for us at the Bend Police Department, as well as the Bend Fire Department, to protect the community, serve them, and take care of any situation we can to improve livability within the community. So in the past, we've refreshed our CPR every 2 years. We've gotten recertified in CPR every 2 years. I foresee our department, in cooperation with the fire department, doing more frequent, quick refresher courses to make sure we're still giving high quality, high performance CPR.
We've truly come to a new era in public safety in the city of Bend. We no longer are working in silos independently. We're collaborating, we're working together. This is not something that all communities have. A lot of communities, there's animosity, there's an unwillingness, there's territorialism. None of that really exists here. We have full cooperation of PD working with us, and it's been amazing.